found a lump. I did mammogram, and after mammogram it was another mammogram, and I got to the point when I had to do biopsy, and I didn't have insurance, and that was a pretty devastating time. I still was looking for options, maybe, but it was not maybe, I had to do that surgery. And at that time, I get a call. It's like a few days left until surgery, and I get a call from Freddie Webster. And from there, WeCare took me, and I was I even didn't know where it came from and how, but since then, they helped me a lot. I mean, they helped me all through chemotherapy, and once I was done, then I was done.
WeCare Jacksonville is completely made up of volunteers and donated services. It starts with a patient who's in a primary care clinic that is independent out in the community. It could be a homeless shelter, it could be a church-based organization. Patients are seen there for basic healthcare needs, primary care. From there, if the next level of care is needed, if they need mammograms, if they find out they need surgery, if they're needing testing, chemotherapy, there's then a connection to WeCare, and we serve as a referral to help them find somebody in the community that will provide that service. Whether it's surgeons, gynecologists, urologists, we've worked very hard to build this network of providers who volunteer their time, and we send the patients to their offices. If they need surgery, then we have a wealth of donated services from the hospitals in our community, and all of the hospitals participate: Memorial, Mayo, Baptist, St. Vincent's, St. Luke's. It's a wonderful network of hospitals, and they donate their services so that the patient actually does not get a bill.
Well, WeCare has historically been a wonderful organization that has played a role in the access to care for the uninsured. Going forward, I'm convinced it is the prominent way in which we're going to ensure access, especially to specialty care.
Jacksonville is very proud of WeCare. You know, WeCare was created because physicians in Jacksonville, particularly Dr. George Trotter, who was then a leader in the Duval County Medical Society, brought together a group of people to worry about this problem. How do we care for the working poor, the working uninsured?
And I thought we ought to demonstrate that the medical community was perfectly willing to take care of underinsured and indigent people.
We have over 400 specialists at this point who are participating, specialist doctors, nurses, pharmacists who are participating with WeCare, and we hope to grow that number even more. In fact, we'd like to double it, just so that we really have the wide range of people available.
Commercial shrimper out of Mayport. Go out 10, 20, 30 days at a time, come home for a day, and then see your wife and your kids and tell them goodbye the next day. They found out I had colon cancer, and it's hard. It hit me hard. I didn't know what it was at first, but then they told me what it was.
And so Tim was very scared, real scared and upset about that.
Well, what happened next, they got in touch with the hospital, and
Beaches Baptist was a great place.
It's a wonderful place to go. They help you out the best they can. And there are wonderful people there, nurses, doctors, everybody. They're incredible.
My shoulder had been starting to bother me over a year or so ago, and kept getting worse and worse, and I could hardly move it. I couldn't do much of anything with it, and it was one of the contributing factors to me having to quit work. So I searched out the different avenues that I could find to help me, because I couldn't afford to pay for it myself. So I found WeCare, and They helped me out to get it taken care of, and WeCare sent me to see Dr. Steinberg. He did surgery at the Jacksonville Orthopedic Institute. Was excited to get in there to see him and see what he could do for me. I went to St. Vincent's, rehabilitation and therapy there, and got through that and doing good. When you find somebody that is willing and able to help, you gotta kind of put your pride aside and accept the help.
Well, I learned about my breast cancer through self-examination, and I noticed a lump. So I started trying to find out information about what clinic I can go to or how I can find out, you know, I can get some help because I didn't have any insurance. One of the organization that I talked to and went to said, well, you know, try WeCare. And to me, that was the best thing that happened to me. That day, because I felt like I had nowhere else to turn. My back was against the wall and I know I couldn't get care, and I thought I was just gonna die of this cancer. WeCare was the best thing that ever happened to me.
Pamela Bell, we just kind of embraced her. She, once she found out where we were, we looked and there she was coming through our door. So grateful for the services that we had done for her. I'm getting better, I'm getting better, I'm getting better, and I know I'm getting better. So again, I thank WeCare for making that possible for me.
Quite frankly, I don't know that I have been any more excited than I am about what's happened, particularly in the last year around WeCare. The tremendous response of the physician community, the unanimous support of the health systems around this sort of voluntary system of taking care of people in our community. So it's been very special.
The way our economics of our country is right now, that a lot of people just don't have access, and WeCare allows that access for those people.
Well, it fits into a part of what I feel is important to do in a communal sense. I made the decision to take care of that person. But what's better is the patients are so appreciative of what you do. They're good people.
I look at it as a miracle to this city that we have so many volunteers who just give so much, not looking for anything in return, just being there and meeting that need. I think it's a miracle.
I'd like WeCare to include every physician in Jacksonville as a volunteer, not just the 400 so volunteers we have now. And that if everyone does their part, it sees 2 to 5 patients a year. We can do so much more for this patient population.
My long-term goal for WeCare is that we continue to strengthen and that we meet the needs of more of the community. There's still plenty of people outside the healthcare system. We really want to try and develop an even broader ability to help patients with their socioeconomic needs, because in the end, that's going to help them help their health needs.
It pretty much says it for itself. We care, and they care.